Welcome back to Winning Isn't Easy. Let's talk about understanding Stevens-Johnson syndrome, SJS, and its impact on functionality. So the obvious first question is, well, what is SJS? It's rare, but it's a serious disorder that affects the skin and mucous membranes. It's usually triggered by a reaction to medication, infection, or both. Now, what are some of the medications that are known to cause SJS? Anti-gout drugs, medication for seizures and mental health conditions, including anticonvulsants and antipsychotics, sulfonamide antibiotics, medications used to treat HIV, common pain relievers such as acetaminophen, Tylenol, ibuprofen, Advil, Motrin, and naproxen sodium, known as Aleve. If you have a weakened immune system due to HIV, AIDS, chemotherapy, or a genetic predisposition, you're also at a greater risk for developing SJS. So it's not just medical, it's just not a weakened immune system. It could be a reaction to medication, or it could be infection, or it could be a combination of all of those things. So there's just not one cause of SJS. But what is important is the disabling signs of SJS. It begins with the flu-like symptoms, and within a few days, a painful rash develops and it spreads, followed by blistering. Now, the top layer of the skin dies, peels, and eventually heals, but that happens over weeks or months. But you'll also see some other symptoms: fatigue, burning eyes, widespread skin pain, a red or purple rash that spreads, blisters on the skin and in mucous membranes, like your mouth, your nose, your eyes, your genitals. You'll also see shedding of skin within days after blistering. It's clear, immediate medical attention is essential, but I find that recovery is often long and it's complicated by chronic issues, much like, if you will, many of the long COVID cases that I have, where medical care is essential, recovery is long, and it can be complicated by long-term chronic issues based on system involvement. Now, the complications of SJS can be long-term and they can be disabling. Even after the initial reaction, SJS can lead to serious, long-lasting complications. And these include blood infections known as sepsis, and potentially a progression of the infection causing organ failure. It can be eye disorders like chronic dryness, inflammation, and even blindness. It can be acute respiratory failure. It can be disfiguring scars and pigmentation issues. Each of these complications can be disabling physically, psychologically, and vocationally. And certainly, those complications can dramatically impact a person's ability to do their own or any occupation, individually and in combination. As we work our way through this podcast, I want you to be thinking about the part of your body that is involved and be thinking about the physical problems that you have. Think about the psychological or cognitive problems that you have because of the appearance of the scarring or because of the pain. And think about how these problems will impact you vocationally in terms of your ability to do your own occupation and any occupation, because it's going to be crucial to develop this to be successful in your short or long-term disability claim. So I've given you a basis. Go get a pen and a pencil, because we're going to take a break. And when we come back, we're going to delve into this in greater detail. Got it?